All right, we'll do our first mic check. 1, 2, 3, 4, 5. And over here for questions. 1, 2, 3, 4, 5. All right, we'll do one more mic check. 1, 2, 3, 4, 5. And over here for questions. 1, 2, 3, 4, 5. We'll get started in about 5 minutes.
Good Thursday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. It's National Nutrition Month. So today, our moment of gratitude is dedicated to our team members at KCHD who work with our community and partner organizations on how to make healthy food choices. Through efforts like our Women, Infants, and Children, or WIC program, Diabetes Management Series, NEAT program, and Parents as Teachers, our team members are dedicated to sharing critical information with individuals and families and businesses about health, about making healthy choices to improve quality of life. And we're very grateful to them and for all the work they're doing. As we sent out in a news release this morning, we are encouraged that the cases and deaths are trending downward in our long-term care facilities. The Tennessee Department of Health announced last week that all of the state's nursing homes and skilled nursing facilities completed both doses of the vaccine, and the assisted living facilities were projected to be completed last week as well. That's great news and something that we know will give peace of mind to many families in our community. It's something to celebrate, definitely. Effective this week, TDH also ended visitation restrictions for long-term care facilities. We continue to urge these places and those who plan to visit to practice the 5 core actions in order to continue to protect the residents and the staff. And then we also encourage everyone to follow the CMS best practices guidelines. They're out there as well. As we look ahead to coming weeks, spring break will be here before we know it. As you make your plans, please do so with the 5 core actions in mind. We are heading in a good direction, a lower volume of cases and hospitalizations and deaths than we had a few weeks ago. But in order to make sure we continue heading in the right direction, we all must continue to do all of the things that help keep those around us and us safe. That includes wearing a mask and physical distancing. The last thing we want to see is our cases and hospitalizations jump up when we have been making such great progress. As announced earlier this week, we will move in coordination with the state and open eligibility to phase 1C on Monday. Pharmacies with federal partnerships in Knox County will also expand their eligibility on Monday morning as well. As we continue to say, we are moving in coordination with the state to limit confusion for folks living in Knox and our surrounding counties. This phase includes those 16 years and older with high-risk health conditions. This phase encompasses a wide range of people. I believe you're looking at right now a full list on our vaccine information webpage. These folks will be able to sign up on our wait list by 8:30 a.m. on Monday morning. We also encourage eligible individuals to look for other opportunities to receive a vaccine in our community. A great resource to do this is the Vaccine Finder webpage that we have linked on our website. So please, if you get an opportunity, please take it and get the vaccine at the earliest way that you can get it. Now, moving into the local situation. We have 95 new cases of COVID-19 since yesterday's report. 1,110 are active cases. 40 Knox County residents are currently hospitalized. And sadly, we have 1 additional death to report today, raising our total to 541. And now we'll turn it towards the benchmarks. All of this data we're going to talk about today is on our website. You can find it at covid.knoxcountytn.gov/case-count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. Over this time period, we saw daily new cases drop to approximately 62 cases per day, down from the previous reporting period, which was around 91. The average number of cases over the past 7 days was 57. This is a lower average we've seen in months. It is important to note, we are seeing these figures leveling off to more of a plateau. We continue to urge folks to practice the 5 core actions and get vaccinated when able to reduce the spread of disease in our community. Because of these factors, though, we are representing this benchmark as green. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. Regarding testing, we continue to see this figure trend down. During this time period, an average of 776 tests were performed each day in our community. Regarding lab turnaround time, this number continues to be consistent at less than 2 days for the community. Because of these factors, we are still representing this benchmark as yellow. Our third benchmark, sustained or increased public health capability. The goal is to increase vaccine distribution across the county. For this benchmark, we are looking at the full public health system, not just KCHD, but also community healthcare partners. As we've said before, having more providers across the community coming on board is critical to getting more vaccine out into our community. This is part of the community vaccination strategy for us and across the state for that matter. The graph on this benchmark will be used to show trends related to vaccine administration. As you can see from the graph, vaccine distribution continues to trend in the right direction across our community. This week, we are representing this benchmark as yellow. We are heading in the right direction still, but we do want to recognize that demand for this vaccine continues to dramatically outpace the supply. While we are hopeful that vaccine availability will increase in the coming weeks, that vaccine availability will increase in the coming weeks with the addition of the new Johnson & Johnson vaccine and also more vaccine coming in from the other vaccine providers as well. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. During this time period, we have continued to see hospitalization numbers decrease. This is encouraging and something that we hope to see continue. After speaking with our hospital partners, they have recommended that this benchmark be represented as green. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. During this time period, we have seen 20 deaths associated with COVID-19, which is down from 29 last week. And in the last 7 days, there were 8 deaths. This is definitely trending in the right direction, but we do want to see it continue. The information leads us to represent this benchmark as yellow. Under our supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of yesterday, our 14-day trend line showed 13 new cases per 100,000, and our 7-day trend line shows 11 new cases per 100,000, both which are down from last week. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health, and the 7-day average for percent positive in Knox County is 12.05%, which is also down from last week and still heading in the right direction. Before we open it up for questions, we want to pull up some data. We have received several questions about vaccination efforts among our minority communities. It is incredibly important how data is looked at and to consider it from all angles. For example, the populations vary greatly among race and ethnicity in our county. So when you're looking at percentage of folks vaccinated, you also have to look at the population and the target demographics. That's what we're doing here with this data. As you can see, in the 65 and up age range, approximately 26% of those who are Asian, 30% of those who are Black, and 37% of those who are white have received their first dose of vaccine. By ethnicity, for those who are 65 and up, nearly 85% of those in our population who are Hispanic and 43% of those who are non-Hispanic have received their first dose. So while there still is a lot of work to be done, I want to commend our team members and all of those organizations throughout the county who are focusing on reaching out and vaccinating our minority communities, as they have made much progress over the past couple of months. These efforts are truly making a difference in our community. And with that, I'll open it up for questions.
All right, for all of our media colleagues in the Zoom, go ahead and submit your questions into the chat feature. From Megan with WVLT, asking how many people remain on the vaccine waiting list.
There are nearly 24,000 entries on the wait list today.
From Austin with WATE, is the health department ready to handle the increase of those that qualify for vaccine in phase 1C?
We are acknowledged that that's a lot of people in our community, and we'll continue to work through the wait list as it stands now and work with our partner organizations to get those folks vaccinated. And it's all based on the supply of vaccine that's coming into our community, how fast we can do that. And so we're excited about that. We're excited about the encouraging news of more vaccine coming in, and hope that we can continue to make good headway throughout the population, including the new groups that are added.
From Allie with Knox News, the wait list is getting longer each day and even more people will be added to eligibility on Monday.
Yep.
How long will it realistically take to vaccinate those who are waiting?
That's really hard to say because it's all based again on the amount of vaccine coming into the community and the providers' eligibility, including ours, to get it out. So there's a lot of factors there, but it's going to be a few weeks. We ask for people and maybe even a few months. We ask for people to continue to be patient because there's a ton of people in the current with the 65 and up age group. And then when you add in the 1C, there's a lot of people that are still out there that need to get vaccinated. Also want to acknowledge that while the list is growing, there are also people that are rolling off the list as well, and we'll continue to do that as well. So that is a living list we want to point out.
Also from Allie asking if we have an estimate as to how many people are eligible now but haven't been vaccinated.
I do not have that for Knox County in my head, and I believe the state reported it out yesterday. I know, or earlier this week. Would have to get that information back to you, but it is a lot of people. When you look at the comorbidities in our population, it's a lot of folks.
Also from Allie with Knox News, once Knox County gets the Johnson & Johnson vaccine, how will KCHD's tracker change, especially when counting people with 1 or 2 doses?
Yeah, we're working on how that will be accomplished. You will probably start seeing changes to just the number of vaccines that have been provided or a completed series of vaccines, something along those lines. We're talking about how we're going to reflect that, but we do recognize that it'll change as we get the 1 dose shot coming in online.
From Megan with WBLT, President Biden said the White House expects there will be enough vaccines for every American by May. Has KCHD received any new news about when a large number of vaccines may arrive here?
We don't have specific information, but we are hearing, and if you've listened to Commissioner Piercy talk this week, there are expectations that the amount of vaccine coming into the state will be growing, especially towards the end of the month. And so we don't know what the details of that look like for us yet, but we're encouraged by the news. So hopefully we'll be able to get there soon.
From Vincent with Knox News, when does the wait list open to people who are recently eligible?
So the 1C group will be available on the be able to sign up on the wait list by 8:30 Monday morning for our wait list.
Any further questions? Please go ahead and submit them now. From Megan with WBLT, about how many people are in the 1C group?
I think I just answered that previously. We'll have to get back to you with what that estimate is for the state of Tennessee and see if we can pull it out for Knox County.
And Vincent says 1 second. I believe he's typing, so we'll wait. In the meantime, anyone else have any questions? Please go ahead and submit them now. From JJ, I believe with Hard Knocks Wire, are you able to track Knox teachers?
Can you ask more specifically what that means? The vaccination rate in that population?
Yeah, JJ, if you can clarify, if you're looking for the vaccination percentage for Knox teachers, we can.
The short answer to that is no. We're not pulling the data that way. We are working with our partners, and you can maybe talk with some of those organizations or actually the schools themselves to get that information.
Okay, and he said yes, that was what he was looking for.
Yeah. So yeah, I would refer you to Knox County schools, and then if you want to look at the other any of the other schools, reach out to them directly, and they can give you better information there, I believe.
From Austin with WATE, has there been a rush to get the Food City location ready as the county prepares for the 1C increase?
We are continuing to diligently work on getting it ready to open. The 1C increase really doesn't matter for that part. We have the goal to have it open and ready to go as soon as possible. I believe our move-in date is the 8th. And then our first clinic there will be, I believe we've announced on the 12th. And so working on just moving towards doing that so we can get it a steady schedule in place for people, our staff and the community to be able to plan.
From Vincent with Knox News, with the 1C group, are the other providers in the community following their own registration protocols?
Yes, they're going to be doing it the same way they've been doing it all along. And as new providers come on, they will use their own registration system. So that's why we really encourage folks to keep an eye on the Vaccine Finder website and then seek out opportunities wherever they are available to you within the community to get vaccinated.
From Megan with WBLT, Will opening the vaccine to a larger group of people make getting the vaccine more difficult for elderly adults who have still not been vaccinated?
At this point, if they're already on the wait list, they're ahead of others on our wait list, and I believe that's the case for others. There are always challenges with that, but on the other hand, not moving in coordination with the state causes confusion, especially when we have federal partners within the county that will be moving along with the state. So some folks will be doing it anyway. So we just want to make sure that we are same across the board so that there's community-wide understanding of who's eligible.
From Allie with Knox News, what services are available to help people get to their vaccination appointments? Are there any organizations KCHD is directing people for transportation?
We'll have to look into that. It's actually a really good question. And I don't have the answer to that right now. So we'll have to follow up.
From Megan with WVLT, has KCHD received any Johnson & Johnson vaccine yet, or is there any news about when you might receive it?
So at this point in time, we will not be getting the Johnson & Johnson vaccine to distribute. On the state's plan, that is going to different providers, and we will be continuing to move forward with the vaccines that we've been getting.
From Vincent with Knox News, does registering for the 1C group require any documentation of a comorbidity, or are folks just able to register?
Nope, folks are just able to register, and it's on the honor system for people to classify themselves appropriately.
All right, any further questions, please go ahead and submit them now. All right, I'm not seeing any other questions come in or anyone typing, so thank you all for your time, and we hope you have a great and safe rest of your day and weekend.